Okay, today what we're going to talk about is the element of shoulder pain, okay? What we can be able to do about it, and what are some of the things that we do that are a little bit unique, okay? So first of which, as we've done in many of our videos, we're going to talk a little bit about the anatomy and what's going on so you have an understanding of that, and then what we're doing and why we're doing it, okay? So the first element that we're going to take a look at is the element of the shoulder, okay? So this is a view obviously from the front where you can be able to see the elements of the deltoid that's present, how the pectoralis muscle kind of fits in, how your biceps fits into the element of the shoulder. And what we look at after that is a cutaway. And what we can be able to see is the inner elements of some of the muscles that exist. Any of you who happen to be sports fans have always heard about the element that's called the rotator cuff. And so there's a couple different muscles that exist that control the elements of the rotator cuff. There's a muscle that's called, to use fancy terms now, but hang with me because I'm going to walk you through it. There's a supraspinatus, there's the infraspinatus, there's the element of how the biceps fits in and the acromion-clavicular, but there's also teres major and teres minor that's present, as well as subscapularis. So those muscles allow for different movements of your shoulder. They allow for you to be able to move your shoulder out. They allow for you to be able to move your shoulder in. They allow for you to be able to move your shoulder up. They allow for you to be able to move your shoulder back. And so all those things we'll look at under examination to see whether you have an issue. But more importantly, in order for us to really be able to assess that shoulder, what we're going to do is we're going to get an MRI to be able to get a better clarification of what's going on with those muscles. Assuming that those muscles have a potential issue, what we're going to do is we're going to give you some medication. The things that we're going to do differently than what some other docs do is we're going to use live ultrasound to be able to get an idea about where those muscles are, even though we have an idea roughly anatomically where it's at. So why are we going to do that ultrasound assessment? Because I've had a number of patients say, well, you know, my regular doctor or my surgeon, they just give me some injection straight into the muscle with no issue and no problem. Well, the reason why we're using ultrasound is because we can see a huge difference in efficacy between the two, or improvement in outcome, if you would. So what we see when we take a look at the elements of the shoulder is that you can have as poor as 50% success with the shoulder injection and doing it blindly or doing it from feeling the anatomy alone, to about an 85 to 90% success rate with doing an ultrasound guided injection. So what does that look like? What are we talking about when we describe an ultrasound injection? So in essence, what you're going to see is we're going to basically have you in a seated position, and we're going to bring an ultrasound probe in and run it over your shoulder, and I'll be looking at a screen at the same time. So that I can be able to see, surprisingly enough, the same muscles I just talked to you about on this earlier when we showed you that picture, to be able to see each muscle, how it moves, how it inserts, the level of issue that's present there. And then while we're doing that, we're going to give you an injection. And where you can be able to see is that that needle is going to come into view under that picture. So if we're having the probe here, we're going to place our needle in close position to the aspect of the probe, and it's going to give us an element of how that needle is going right near that muscle. So we can be able to see an injection into the aspect of the joint or the muscles that have a potential problem. That's what we're looking to do with an ultrasound guided shoulder injection for the various different problems that may erupt with a rotator cuff issue.